Welcome to the Summit PT Podcast, your guide to recovery, performance, and wellness. Today we're going to be discussing vestibular issues and understanding the differences between dizziness and balance disorders. Our guest speaker is Dr. Lauren Wagehoft. She is a vestibular specialist in the physical therapy world and is also at our East Brainerd location. Today we're going to be explaining exactly what the vestibular system is and what vestibular therapy looks like, what some common causes of dizziness are, and how physical therapy can help improve balance and reduce symptoms. So if we can kind of get into this, Lauren, what is the vestibular system and why is it so important?
Yeah, so the vestibular system refers to the inner ear. The inner ear has functions both in hearing and balance. So we have one on both sides. It's about the size of a dime. So the balance portion is composed of three canals called the semicircular canals. And then there's also two otolith organs, which contain tiny little crystals called otoconia that we're all born with. And all of it has a really important function on helping our brain understand where our body's at in space. So with different head movements and helps our brain know how fast we're going and in what direction.
So I kind of think of it, and you can correct me if I'm wrong, like a level that you would hang a picture with, and how that bubble moves in that level, and that's kind of what those otolith crystals do, right?
Yeah, that's a really good comparison.
What are some common causes of dizziness?
So dizziness is a really broad term. So there's a lot of different types of symptoms that could be called dizziness. So I like to break it up into 5 different categories. So the first is vertigo, which is the true sense of spinning. Either the person feels like they're spinning or the environment is spinning. So one of the common causes of that is something called BPPV, where those crystals that are inside the inner ear get broken off and trapped into one of the canals. And so that can cause a positional vertigo, typically lasts about 30 seconds with position changes. So that's just one example of what vertigo is. And then lightheadedness, which is like a woozy feeling. So it might be like when you get dehydrated or if your blood pressure drops with position changes. Third is like, motion sickness. So like what a lot of us would think of as like getting off of a roller coaster, kinda like the nausea
Being
feeling.
in the car and being on your phone.
Yeah. And then, disequilibrium, which is just being off balance, wobbly on your feet. And then the last one is behavioral dizziness. So that's, related to, like, anxiety, fear of falling. And a lot of times, patients won't just fit into one category. A lot of times it's multiple, but, I like to tease out, what exactly is the person feeling when they say they're dizzy.
So we often get referrals for physical therapy. It's either for benign positional periaxomial vertigo, the BPPV. We also get people that aren't very good at balance. You said something earlier that the fear of falling, I was always taught back in my day that the number one cause of falling is the fear of falling.
Yeah.
Uh, so what are some of the things that physical therapy can actually help with dizziness? Because when I'm talking to some of my like my dad's friends or my dad or his wife or just some of our patients, they often don't know that physical therapy can actually help with different types of dizziness or balance issues.
Mhm.
So, what are some common things that physical therapy can do, or some common techniques that we can do as physical therapists to help with balance or dizziness, or some of the things that you talked about earlier?
Mhm. Starts with a really thorough evaluation to decide, what exactly is causing the dizziness or balance impairment. So with that, there's positional testing to check for if there's positional vertigo component. So for people that have BPPV, you have to identify exactly which ear and also which canal is affected, and then there are different maneuvers that a therapist trained in vestibular rehab could do to resolve that problem. If it's balance, we have to determine what that person's specific, I call it sensory strategy is. So there's a theory called sensory reweighting theory where there are essentially three strategies we can use to maintain our balance. We can use our eyesight to see where we're going, our feet to sense the ground that we're standing on, and then the third is your inner ear, which is especially important when you're moving. So if somebody has an inner ear issue, a lot of times they'll compensate for it by depending on one or both of those other strategies. So, for example, if a person is dependent on their vision, then we need to give them exercises where their eyes are closed or if we're confusing their vision. And that way we can get them to rely on those underutilized strategies. And with that, usually the dizziness will gradually improve as the balance improves.
Okay. Uh, what about concussion? I know that just kind of popped in my head, and I know I've had a couple concussions, and I've seen quite a few concussion patients. So, uh, are there things that you can do for concussion as well?
Yes, absolutely. Yeah. So a lot of times patients will have dizziness, nausea, headaches following a concussion. So there are a lot of bedside tests we can do looking at the eyes and also the vestibular system. And depending on what the impairments might be, a lot of times I end up giving concussion patients a lot of visual exercises to work on at home. And a lot of times they'll cause the symptoms, but in a controlled way. So we want to kind of get them used to those symptoms again. So eventually they'll decrease.
Yeah, kinda going down that rabbit hole of concussions, and sorry, I didn't mean to go this way, but it just kinda had me thinking when we talk about concussions and you talk about using the eye exercises, but we also work on the other systems. There's, like, 5 systems that we work on when we do concussions, right? So you use the eyes, the ocular system, the vestibular system, which you mentioned earlier, the cervical spine. Can you touch a little bit on how somebody's neck could cause dizziness? Maybe like the upper cervical spine and all the tension that you have there. Can that be a cause of dizziness?
It can. So there are nerves in your neck that help your brain understand where your head's at in space, just like the vestibular system. So those can also be damaged if there's been some kind of a trauma, like a concussion. So
Kinda get that whiplash and
yeah. So just helping improve proprioception, which is just a fancy word for understanding where you're at in space. A lot of times that's impaired just also with neck movements. People with vertigo also tend to get neck pain as a response because naturally the response when you're dizzy with certain head movements is to just avoid moving your head. And that can come with a lot of problems like just increased tension, stiffness, so a lot of times, yes. So a lot of times they kind of go hand in hand, not just with concussion patients, but also with the vestibular patients.
absolutely. So just having a thorough evaluation is super important to determine what systems you're gonna be working on for a balanced patient, for a dizziness patient, for a concussed patient. Excellent. Okay. Um, what are some signs that someone should seek physical therapy for balance issues?
Yeah. So I say fear of falling is a really big one, or history of falling if there's actually been a fall. Somebody with known issues like with vision or even a hearing impairment also can affect your balance. Peripheral neuropathy. So if you have impaired sensation in your feet, that will have a profound impact on balance sometimes. Anyone that has like positional dizziness where they notice like every time they get out of bed or lay down in bed or look up that they get dizzy. It's not something that you have to live with. You can get that treated.
Yeah. So speaking of, so if somebody does have dizziness or balance issues, and what should they do?
I would say in certain situations, like if there's a severe unrelenting vertigo with nausea and vomiting, that would be a sign to seek out a emergency medicine provider just to make sure nothing serious is happening. But in most cases, it's okay to just to go ahead and schedule with a physical therapist who's trained with vestibular rehabilitation. And you can do a really thorough evaluation and get to the bottom of what's causing the problem.
And it sounds like having that specialty is very important to properly diagnose it, to figure out the root cause of it. That you just don't want to be chasing your tail and working on single leg balance or working on an unstable base, and it may not even be that proprioceptive system that you spoke about. It could be the inner ear, it could be the cervical spine. So, really searching out the right person is what I'm hearing you say, is really searching out the right person to help to get to the root cause of that.
Mhm.
Yeah.
Absolutely.
Do you have any success stories you've been doing this for a long time, so could you maybe share a success story that you've recently had that's top of mind for anybody out there that may be on the fence?
Yeah. So this one is fresh on my mind because I just discharged this person this week. It was a man in his 40s who worked as a truck driver. And he was born deaf in one ear, so he already had a pre-existing ear problem. But he had a severe dizziness that made him unable to work as a truck driver because he would get severe motion sickness while he was driving. So when I first started seeing him, his wife was having to drive him like to all his appointments, and he couldn't even go like to the grocery store. He was having symptoms just with the visual component of like walking down the aisle. So we did 6 weeks of rehab twice a week. So he did a lot of visual exercises at home and then balance exercises that were targeted to his problem. And he was just cleared to go back to work. He's not having any dizziness at all. We also worked on his neck. So,
Being in the truck and just having looking straight forward, you don't get a lot of rotation or a lot of other movement. So I can definitely see how that's relatable. And you bring up a good point as well. As when I think of balance concerns, I typically think of like the geriatric population, which first person you mentioned was somebody in their 40s.
Mhm.
So from a population's demographic, I guess I would say, is there it could range from anybody. Can you tell me a little bit more about the demographic?
Yeah, so I've seen people in their early 20s also with concussion or um BPPV. So I really have seen all ages. I'd say the majority of my patients have been older, like 60 or older. Um
Do you
but
think
yeah,
that's
it
just
could
because
really
of, like, doctors referring that patient population versus not knowing that there's something that, for a 40-year-old that could be done?
yeah, I think we could do a lot of work with raising awareness that that this is a service that's out there and it's not something you have to live with.
Absolutely, absolutely. Well, just to kind of recap what we was there anything before we recap, is there that anything that I didn't answer that you wanna kinda discuss or talk about, go down that trail? We talked about the vestibular system, we talked about the inner ear, we talked about the cervical spine, how the upper cervical spine could cause some issues. We talked about the ocular system, how that could be a problem, the proprioceptive system, peripheral neuropathy, not being able to feel your feet. We talked about quite a few different reasons on why you could be dizzy or have a loss of balance. And we talked about the fear of falling. And once you fall once, is there a likelihood that you would fall again if you don't get some type of treatment? And then if you do fall, then typically you're going to break a hip or you're going to break a wrist, and then you're going to get weaker in the legs. And that's one thing that I've heard recently is that uh, one of the number one predictors of longevity is quad strength. And you typically see a lack of quad strength in those that are falling.
Mhm.
So you can kind of see that correlation there. And then those that do fall, then they can't get up and socialize and walk around. They don't have the strength in their legs, and that leads to the possibility of falling again,
Mhm.
leads to a less than fruitful life because now we're not mingling out in society and communicating with people. and that could really be a problem for depression and for falling and just your overall lifestyle. Yeah. All right. So I appreciate your time and discussing the vestibular system. And you brought up a lot of good points that I wasn't even aware of. And if there's anybody out there that really struggles with dizziness or with balance, then they can reach out to us and see what we can do to help them. You can reach out to us at summit-therapy.com or give us a call. Yeah.
That'd be great.
All right. Thank you for your time, Lauren.
Thanks for having me.
Absolutely.